again, if you go to see your primary care doctor and you say, hey, doc, what's my risk of heart disease? Then they'll follow the guidelines, and the guidelines will say, are you having symptoms? Yes or no. And if it's a no, then they'll get a lipid panel and they'll check your cholesterol and they'll stratify your risk by saying if you have a high cholesterol, you're at a higher risk. And if you have a low cholesterol, there's nothing to worry about, and they'll ignore you.
What are those numbers for cholesterol?
And they've arbitrarily, picked a number of 200. Cholesterol greater than 200 is deemed to be a high risk, and a cholesterol less than 200 is deemed to be, quote, okay, or low risk.
So that when people talk about the American Heart Association, high, medium, and low risk, they're just talking about cholesterol numbers, or do they factor in other things?
Originally, and the guidelines today look at cholesterol, just total cholesterol, but other strategies have employed using, a whole series of risk factors. And the current risk factors, if you add it all up, it tends to be inaccurate. It doesn't really accurately predict your risk, even if you combine other factors like family history, weight, hypertension, diabetes, things of that nature.
So you're saying, okay, so use cholesterol. So then where do they go with cholesterol? You say you're under 200 or over 200, high risk, low risk.
Well, if you've got a high cholesterol, then you are put on Lipitor or statin drug for the rest of your life.
What is a statin drug for those that don't know?
So statins are a class of drug that you take usually once a day, and they lower serum cholesterol, primarily by lowering the LDL cholesterol, by blocking, it's an HMG-CoA reductase inhibitor, which is a special enzyme in your liver. And so it blocks cholesterol metabolism. So the statin drugs are actually very effective at lowering your cholesterol and lowering your HDL. It's just that I think there's a big question about whether that strategy prevents heart disease. And in my mind, clearly it does not.
There have been a lot of studies. I mean, statins have been out there, these drugs to reduce cholesterol, for 20 years. What's the evidence that they're actually working?
There's really no evidence that they're working. In fact, it's quite the opposite. There's been at least 11 major international randomized placebo-controlled clinical trials over the last 2 decades. These are involving over 65,000 patients, over 250,000 patient follow-up years. I mean, the cost just to do these studies was probably $100 million. And if you add it all up, there's no evidence of any benefit when compared to placebo in terms of preventing heart attacks or prolonging your life.